Stewart, and I am President and CEO of March of Dimes, and it really is a pleasure to be here with you all this afternoon, this morning, depending on where you are, for this next series of our Healthy Mom, Strong Baby series. It is really a very important topic that we have to continue to talk about as long as we're still in this pandemic. We have to continue to really make sure that a lot of pregnant women are up to speed on everything they need to know with respect to COVID-19, the vaccine, and all the issues and concerns and questions that women, expectant moms, new parents, pregnant people may have about these issues. So I'm really so excited to have this conversation. You may be thinking we've talked about this before, and we have. Unfortunately, the latest data tells us that less than 35% of pregnant people are vaccinated. So even though we've been talking about it, it looks like we have to keep talking about it because we are very concerned about the number of pregnant people who may be unvaccinated and maybe putting themselves at risk and maybe their babies at risk. And we want to make sure that as many pregnant people as possible have the information they need to make good choices and good decisions to keep themselves safe during this pandemic, which has not left us. It is still very much here, despite the fact that we may not be wearing masks as much as we were, and we may not be social distancing as much as we were. That doesn't mean that we don't have to consider where we are and keep ourselves safe. The level of unvaccinated pregnant people, though, is really something that is very concerning. More than 187,750 cases of COVID among pregnant women have been documented, with 293 deaths, over 30,000 hospitalizations, over 18,000 of those to the ICU with respiratory support, 18,000 pregnant people going to the ICU and being put on respiratory support. This is sad and it is concerning. One recent study found that the risk of death for women with COVID-19 is 22 times higher than someone who is not pregnant. And another study found that the risk of hospitalization with serious complications is 40% higher than other pregnant women. We also know that the risk of premature birth and stillbirth among those who contract the virus during pregnancy, all of those risks are much higher as well. And yet somehow these myths and fears around the COVID vaccine and pregnant women, pregnant people are still there, and it still is causing a lot of concern and a lot of fear in terms of whether or not pregnant people should become vaccinated. So what we want to lay out today, obviously, is just to be crystal clear that the research shows that COVID-19 mRNA vaccines are safe and they are effective in protecting against the virus during pregnancy. In addition, evidence also suggests that the benefits of maternal vaccination extend to newborns. There was a CDC study of more than 46,000 pregnant women that showed that the vaccine did not increase the risk of delivering preterm or smaller babies. It did not. And there are other recent studies that have resoundingly shown that vaccination does not affect fertility, does not affect fertility, which I know has been another concern. The vaccine has also been proven to be safe for baby while pregnant and while breastfeeding. Research has even shown that the protective antibodies that mom's body produces against COVID make their way across the placenta, make their way into breast milk, and potentially offer a baby some protection. The CDC continues to urge the vaccine for any people who are pregnant, breastfeeding, trying to get pregnant, or may become pregnant in the future, both for their own safety as well as the safety of the baby. So today, frankly, what we want to address is vaccine hesitancy. We want to address the fact that we understand that there is concern. We understand why there should be questions, and there is absolutely nothing wrong with asking questions and being sure and making yourself comfortable that you have all the answers. But what we do want to make sure is that when you get those answers and when you ask those questions, you're asking them to the right people, the people that know and have experience of what they're talking about, and they can share with you the truth about how to think about the vaccine, especially if you're pregnant or think that you might be becoming pregnant. We are so thrilled at the March of Dimes to be collaborating on today's webinar with the Kaiser Family Foundation, a national nonprofit leader in health policy analysis. A lot of us follow the Kaiser Family Foundation. We get lots of great information and data from the Kaiser Family Foundation. They share our mission in spreading the awareness of the importance of the COVID-19 vaccine, keeping pregnant people safe. And so we're really honored and pleased to be a part of this collaboration with the Kaiser Family Foundation. As part of their Greater Than COVID initiative, they've recently launched The Conversation, which is a new video series featuring trusted healthcare workers answering common questions about the COVID-19 vaccine and addressing some common concerns relating to pregnancy and to family and fertility. The goal of the campaign is to help increase vaccination rates, especially among Black and Brown communities, which have been disproportionately impacted, as we all know, by the pandemic. This series is really helpful in breaking down our topic today, and we're going to actually see one of the videos that have been produced as a part of this program. So here are the 5 things to know about the COVID-19 vaccine and pregnancy.
What I try to explain to patients is that the vaccine is safe and effective at any trimester in their pregnancy.
There is absolutely not any increased risk or any relationship between getting the COVID vaccine and a risk for miscarriage.
The truth is, you're more vulnerable when you're pregnant. Waiting till after you have the baby is actually putting yourself in more harm, you and the baby in more harm's way, because you are actually more at risk while you're pregnant.
You want your immune system protecting you and your baby. You don't want it having to fight off something else. It is important that it is serving its essential function during pregnancy, which is to help keep you and your baby healthy.
When pregnant people get the COVID vaccine, those protections pass through the placenta. So it means that newborn babies that are born to pregnant people that get the vaccine are protected when they're born.
If you're thinking about what can I do to really be healthy because I'm nervous about COVID and I want my baby to be healthy and I want to be healthy, the vaccine is the best way for you and your baby to be healthy.
And for me, it's super important, not only as a healthcare provider, but because I'm also pregnant and want to make sure that my pregnancy is as safe as possible.
Pregnancy is a condition that by definition causes immunosuppression. Your immune system is already working overtime to keep you and your baby safe.
During pregnancy, the body has particular changes that might actually make you more susceptible to respiratory infections. And so patients who are pregnant can actually develop more severe infections of COVID-19.
If you are pregnant and contract COVID-19, you're about 6 times more likely to be admitted to the ICU, and you're about 4 times more likely to have a baby that comes too early. So what we want to do to decrease that risk is get you vaccinated.
If you're not yet pregnant, we have no evidence that shows that COVID-19 vaccination causes infertility or that reduces your fertile window.
We can say with confidence that there really is not anything in the COVID vaccine that could impact someone's fertility.
In fact, I have a 28-year-old daughter, and I was so excited that she got vaccinated. I want to make sure that she preserves her future ability to maintain a pregnancy, and so the best way was to ensure that she's vaccinated.
We're recommending boosters for pregnant people at any trimester and including in the 6 weeks postpartum.
Immunity wanes over time, right? And so by boosting our immune systems, it allows us to have this continued level of protection that we had when we were initially inoculated.
My goal is to have a safe and healthy pregnancy. And I know that because these vaccines have been deemed to be safe and effective, I want to be able to provide my baby the opportunity to hopefully be as protected as possible against COVID-19.
Such a great video, so easy to understand, and I love seeing all of our good friends in that video too, which is so nice. We're going to share links to the conversation campaign in our Facebook comments section. The videos are also available in English and Spanish. They're a very useful tool. And the other thing I want to say is that another resource you should consider is also at the March Times, our News Moms Need blog, which is frequently updated to provide moms and moms to be with trusted information. We'll have a lot of information there to share with you as well. And with that, I'm so excited to kick off our conversation today and get going. The goal is to discuss the benefits of being vaccinated along with the risks of not being vaccinated. So we hope we can increase your confidence and help you make some of the right decisions. As always, in these Facebook Live sessions, if you have comments, if you have questions, feel free to put them in the comment section. I will get them and see them in the chat. I think we already have one, so we're probably going to take one pretty quickly here once I introduce all of our guests. And please keep the conversation going so we can you can get all your questions out in this time period. So I'm really excited to introduce our panelists today. Really excited to hear from each one of them. And I'm going to start by just introducing first Dr. Ebony Marcel. Ebony, I should call her Dr. Ebony because she just recently earned her PhD, and we're so proud of her. She is the director of midwifery care at Community of Hope, which is a nonprofit community-based health center here in Washington, D.C. That includes family health and a birth center. She's also an adjunct faculty member at our mutual alma mater, Georgetown University, and she runs her own consulting company, Midwifery Melanated LLC, which focuses on rebuilding systems to address racism and health equity in Black maternal health. And she is known nationally for her passion around midwifery care and midwifery's role in reproductive justice. Our next guest is Dr. Edith Bracho Sanchez. She is a pediatrician. She's also the medical director of pediatric telemedicine at the Ambulatory Care Network of Columbia University Medical Center, New York Presbyterian Hospital in New York. She obtained her medical degree from New York University School of Medicine, followed by residency training in pediatrics at CHOP, Children's Hospital of Philadelphia. She also completed a fellowship in global health and journalism at Stanford University in partnership with CNN and the International Rescue Committee. Dr. Bracho Sanchez is also featured in Kaiser Family Foundation's new campaign that you just saw, also available in Spanish. So thanks for joining as well. Lucy Fink has been a guest, as have others that are here today, Ebony and others, on our Healthy Mom Strong Baby series. We heard from Lucy not too long ago about her journey navigating and thinking about pregnancy and motherhood and vaccinations. She is an award-winning digital creator who produces her own original video content for an audience of millions across YouTube and Instagram and TikTok and other channels. She has chronicled her journey through pregnancy and now motherhood. She joined us last August and talked about her decision to get the COVID-19 vaccine while she was in her first trimester of pregnancy. And today she is back with a new 4-month-old baby, healthy baby boy. She is healthy as well. And we're going to hear more from Lucy about her journey, her decisions, and how she navigated all of those journeys through motherhood in the midst of a pandemic as well. And then last but not least, Trices Anadimaka, sorry, and I got that right before. Now I didn't get it right. But Trices is a new mom. She lives in Chicago, Illinois. She has an incredible story as well. She was unvaccinated during her pregnancy. Trices was 6 months pregnant when she ended up in the ICU battling COVID-19. She was fighting for her life and for the life of her baby as well. She recently shared her story on CBS News, a national story on this, and she talked about the serious risks facing unvaccinated pregnant women. Trices is here. She's going to share her story with us, discuss a little bit more about her initial hesitations around getting the COVID-19 vaccine and what ultimately led her to her decision to get vaccinated. And that happened during her stay in the hospital last year. So that's going to be a nice story to hear in terms of the struggles that so many women face around vaccinations, and then how she eventually was convinced on what she needed to do next. So I'm just really pleased and proud to be moderating with these amazing women, and want to get into our discussion. And for that, I'm going to actually turn to first Ebony and Dr. Marcel and ask if she would just start us off in this conversation, because of all the work you do in health equity and building awareness around how to stay safe and healthy during pregnancy, especially for Black and Brown moms. Just want to start with what your thoughts are about what you see as some of the common concerns, maybe even common misperceptions that expectant moms have about getting the vaccine, and tell us how you've helped address some of those concerns with those women.
Absolutely. So I think that when anybody is pregnant, they're worried about taking anything. That's one of our most frequent reasons why people will ask us in the office or even page to talk to a provider before they take anything. And so just overall hesitancy about taking anything. And there's still a lot of people that believe a lot of the myths, concerns about themselves, their pregnancy, their future fertility. And so some of the ways I just kind of combat is just to give them real data. I send them to, the CDC website and really talk to them, and explain that, COVID is unforgiving and that we want them to be safe. And there's a reason why we're recommending it and why we're supporting it. Still get a lot of pushback, but I do think that as providers, it's very hard to not sound coercive. So making sure that, we want families and birthing persons to feel supported in whatever decision, but also making sure they understand the importance.
Very good. Yeah, I think it's obviously some really legitimate reasons why, a lot of pregnant people would want to have a lot of answers to some very, very common questions that do come up. And so I think I want to reassure everyone that these questions that people may have are completely legitimate and completely understandable, but we do want to make sure you get good answers to some of those questions as well. So Dr. Edith Bracho Sanchez, and actually we've already gotten a couple of questions from Facebook, and I feel like I want to point them to the doctor. So I may spend a little bit more time with you before I get to Lucy and Trices. But let me just first thank you for being here. And it's hard to believe that it's been about a year since the COVID-19 was, became widely available. What do you think we know today that we didn't know a year ago about the COVID-19 vaccine?
We know so much more than we did a year ago. And I'll just very briefly share my own personal experience as well for context. I'm here in New York City. You all know we were first to get hit. And after that, there's been, really no city has been spared in this country and around the world. When we first got hit here in New York City, working as a pediatrician on the ground in Washington Heights, patients coming from the Bronx, really the hardest hit communities. I remember, I will never forget turning to my colleagues and saying, are you seeing newborns coming in just a little bit lighter on the weight? Are they coming in just a little bit early in terms of when they're born? And we all started talking to each other and saying, gosh, yes, like these newborns from these moms are really coming in just a little premature, just a little bit under the weight. And we didn't have that data yet of how severe, how serious COVID could be for pregnant women. And then at the same time this is happening, I recently had gotten married. My husband and I were sort of thinking about having a baby. And I just remember saying to him, we have a history of a miscarriage. And I remember saying to him, I want to try again as soon as a vaccine is available. I want to try when the vaccine is available, because I was seeing on the ground the consequences of women becoming infected during pregnancy. And sure enough, a vaccine became available. I went and got it. And I said to my husband, okay, let's try. I happened, and I share this with you, it's very personal, but I will share this with you because I think it matters. I happened to be ovulating when I got the first shot. And I said to my husband, okay, let's go ahead and try. We got pregnant on that cycle. So when I see the data now that the vaccine does not affect fertility, I'm like, I can tell you. and I carried the term. My priority was to protect myself, my baby, the pregnancy. I now have a 5-month-old baby, almost 6 months old. And now we have the data that this is absolutely safe, that actually when you get vaccinated, you can pass on antibodies to your baby. And that if you don't get vaccinated, every day that you're not vaccinated, you're not protected and you are vulnerable. And you have already shared some of those statistics of how serious this can be. So just to sort of sum it up, we just know so much more now than we did when I first made my decision. And the data that we have keeps coming, and it is so reassuring about how safe this is.
That's great. And because we have a couple of questions from Facebook, and I know how people are when you have a question on your mind, and because it came in so quickly, you want an answer right now. So I want to hurry up and get to it. So let me ask you, Doctor, a couple of quick questions that have come in. So one question is double vaccination enough? So if you've gotten 2 shots, is that enough right now? And do pregnant women need a booster?
So the recommendation is that you do go ahead and get a booster because the immunity can wane for all of us, right? I think the only group for which we're not yet recommending boosters is for children 5 to 12 because they just started getting vaccinated. Everyone else, 12 and up, pregnant women, older people, the immunity truly does wane, meaning it goes down with time. So we really do want to go ahead and get that booster as soon as we're eligible.
As soon as you're eligible. And then another question on that is, can pregnant women mix and match vaccines? For example, if the first 2 shots before pregnancy were Pfizer and during pregnancy is Moderna, is it possible to mix and match? And is there any concern about that?
No, so you can. There actually is. I'm not sure about the data specifically in pregnant women. I haven't seen it, but there is some data that when you do, you might even have a stronger immune response. But so far, what we have said, the CDC, all of the medical societies, what we're saying is go ahead and get boosted or get your additional shot with another mRNA vaccine if you can, but it does not matter whether it's Pfizer or Moderna. You just want it, if you can, to be an mRNA vaccine.
That's great. And then the last question, then we'll go on to our other panelists since we have another one from Facebook. The question is, can we talk about vaccine symptoms? And I know when I got my vaccines, it was a little bit of a doozy, and I'm not pregnant. I just a normal, healthy person. People can have a reaction, and that's actually a good thing, right? Because that's showing that the vaccine is actually working in our bodies. But the question is, can we talk about vaccine symptoms and whether that immune response causes inflammation or can cause any issues during pregnancy?
Yeah, so pregnant women can have a response very much like everyone else is having to the vaccine or has had at this point to the vaccine, right? So there can be a little bit of a low-grade fever, very important to treat in pregnancy, and to treat, we should say specifically with Tylenol, not Motrin. We can't really take Motrin in pregnancy. That happened to me. I spiked a low-grade fever. I took some Tylenol. It went away. That was the end of it. Pregnant women, of course, can get tired, of course, can get a little bit of muscle aches. This, however, is not dangerous to the woman or to the baby. Okay, so just to be super clear that even if you do experience some of those side effects, they are transient. They go away quickly. They can be treated with Tylenol, and they're not dangerous to you or to the baby. Now, when it comes to the inflammation, it is correct. So the vaccine triggers a very local inflammation, local being the key word though, because it really does, what it's doing is, it's sort of like bothering, this is how I explain it to my families. It's bothering the body, creating an inflammation locally so that the immune system sort of gets activated, and then goes ahead and makes that protection that we needed, we want it to make, right? So yes, there is inflammation. However, it is local and it is very limited. It does not last, and it is not dangerous to you or the baby.
That's great. And congratulations on your baby. That's such good news.
Thank you.
I didn't realize we had so many new moms on this today. This is really great. That's awesome. So Lucy, I want to just turn it to you. First of all, congratulations on your son, Milo, and so glad to hear how he's doing, and great to see that you're obviously doing so well yourself. For new people that didn't hear your story before, can you just reshare your vaccination story, when you got vaccinated, how far along you were, what that decision-making process was for you?
Yes. So last year, 2021, I found out that I was pregnant on April 2nd. And that was, right at the 2 weeks post-ovulation mark. So I found out right away as soon as I could. And at that point, I, of course, was 4 weeks pregnant. And I remember it was right around the time when the vaccine had become available for women in my age group, people in my age group. And so I actually remember saying to my husband, I want to get pregnant before I said, I want to ideally get vaccinated before I get pregnant, because there was not a lot of data about pregnancy and the vaccine. So I had tried to time it where I could get my vaccine and then move on to get pregnant, but I ended up having a very long cycle and it took me a while to conceive. And I wound up finding out I was pregnant right around the time when all my friends were signing up for the vaccine. And I had an appointment scheduled to get my vaccine like that week. And I called my doctor, I called the CDC's hotline that was available at the time, and I just asked a bunch of questions. And although I think that was actually around the time, I just looked it up, it seems like on April 5th, which is 3 days later, that was the first time that there was an actual recommendation from the, American Journal of Obstetrics and Gynecology that suggesting that we should vaccinate pregnant people. But I still felt like it was so early and I was concerned, and I got mixed matching opinions. So my primary care doctor suggested that I wait till the second trimester because she just wasn't sure of the data at that point. Whereas my OB, whose opinion I was weighing a little bit more heavier in this situation, she suggested that I get the vaccine. And she knew when she was telling me that she thinks I should get it, she knew that it was still at this point, not a really strong recommendation from her, but it was like if I were you, I would. And the way she said it to me was, she actually said, if you were my sister, I would tell you to get the vaccine, which meant a lot. And I remember, I spoke to the people from the hotline. My OB told me to do it. And at the same time, I myself was an undergrad at Johns Hopkins University. And so I happened to have a lot of medical friends and people who are now doctors and in the medical field and working in hospitals who were seeing some pregnant people with COVID coming in and seeing the horrific side effects of that. And so from all those people, I was getting all the information about the fact that, this is an mRNA vaccine. The vaccine cannot cross into the placenta and poison the child, any of that. And so I moved ahead. I think I gave it a few weeks. I didn't want to do it like the day I found out I was pregnant, but I gave it until I was 7 weeks pregnant. So still in my first trimester, and I got my first Pfizer shot. And then 3 weeks later at 10 weeks, I got my second shot. And my biggest fear, as I mentioned on the last panel, my biggest fear was just that the development of the baby was going to be affected. Like I remember thinking I was going to go in to get a scan and he was going to have like 3 arms or something because of this vaccine. And, thankfully none of that was the case. And I was assured that the only thing crossing the placenta was the antibodies that my body was creating in response to the vaccine. And the baby was not affected at all. And Milo's now here and he's healthy. And I'm very, very grateful.
That's so awesome. And then you also got a booster before he was born, right? So you went through the whole series.
I actually got a booster shot the day that I was in labor. So I had and it was 3 weeks early. He was born 3 weeks early. So he was due December 12th, but on November 20th, I was scheduled at Walgreens to get my booster. And I woke up that morning to contractions and I went anyway to go get the booster. I actually think walking to Walgreens brought on my contractions even stronger. And so I walked to the counter. I was, taken into the little room with the curtains. And I said to the woman who was giving me the shot, I'm in labor, I'm having contractions. And she was like, you're crazy. But I got my vaccine. And then that night I went to the hospital and Milo was born at 2 a.m. the next morning.
Yeah, well, so you weren't crazy. You were just.
I was very thankful actually, because
Yeah.
I knew that I was going to try to breastfeed him and now I am successfully breastfeeding him, but I didn't know that it was going to be successful. And I knew that I wanted to try to get those antibodies to him as much as possible. And so I figured if I could get this booster vaccine in before he's born, hopefully he'll get a little bit more immunity before he comes out.
Absolutely. Absolutely. That's so smart. That was awesome. Well, thank you for that. And Trices, thank you for being with us today. And some of us had a chance to see your story. It was a very moving story on CBS News. And for those that haven't had a chance to hear your story, can you tell us a little bit about your journey as well, which was a lot to handle for you. So we're glad to see you here and glad to see you doing well.
Thank you. It's so funny as you were sharing some of the statistics, just about what, pregnant moms are experiencing. I found myself getting emotional because I checked so many of those boxes, like so many different women do. And one of the things that I've really haven't had the opportunity to talk about is the experience as a Black woman in healthcare and what that was like, and how that also impacted my decision to, number one, get vaccinated. The history of vaccinations with African Americans in the United States made me reluctant to get the vaccine initially. There wasn't a lot of data. I'm a later in life mom. It took my husband and I years to get pregnant. So I wanted to mitigate the risk of anything going wrong in my initial pregnancy. And unfortunately, lo and behold, I contracted COVID at 6 months pregnant. And I was admitted to the hospital. And unfortunately, I was admitted to ICU. And what makes my story unique, but not so unique, is I'm seemingly a middle-class, educated woman, great job, great career. My husband and I are thriving in this life. And the doctors and nurses didn't believe me that I had breathing issues. They didn't believe that they didn't understand the ramifications of double infiltrate in my lungs. Throughout the process, due to some of the challenges that I had around just being believed that I actually was having these extreme breathing issues, even though I was admitted to ICU, I was on a BiPAP. All the numbers kept saying I was getting better, but in my body physically, I knew that I wasn't. And so the goal was to, of course, get my, oxygen levels down to get me out of ICU. And oftentimes they would make the decision for me and turn down my oxygen. And I would wake up in the middle of the night gasping for air. And we later found out 75% of my lungs had been damaged by the pneumonia in both of my lungs. So my situation was very unique in that not only was I fighting for my life from COVID-19 and the implications that came with that, I was fighting for my life in the healthcare system because my voice was not heard and nobody believed that I literally could not breathe to the degree that I couldn't. I could remember even one point I told the doctor, and in ICU, I actually couldn't talk. So I was writing things out. I told the doctor to intubate me. I said, I'm done. I have no more fight. Let my body birth my son into this world and let my husband and my mom raise him, because I had no more fight left. And I remember my doctor set me down and they said, just one more night, give us one more night. Just take it one breath at a time. We don't want to intubate you. That's not a good thing. And just kind of hang in there with us. And I did. And I literally was just taking it one breath at a time. And ultimately I, transitioned into the regular maternity ward, but it was such a journey getting there. And I feel like my voice speaks for a lot of the women that didn't make it out of ICU. Their babies will never get to know what it's like to get an embrace from their mother. A husband or partner doesn't know what it's like to raise this child with the partner that they created this beautiful being with. So I just thank you all for this platform and talking about this. And I do believe that vaccination should be the choice of the mother and the family, but I think it's important to have all of the information that you can so that this is what could happen if you choose to not be vaccinated, and this is what could happen if you do.
When you were in the hospital, it's so moving. I first of all, I just am so glad that you were able to fight through that, and that you're here and your baby is here. Tell me what you were thinking about when you were 6 months pregnant and getting COVID, and then when you got so sick, thinking about the vaccine. And were you regretting at that point not getting the vaccine? Were you too sick to even worry about it at that point? And at what point did you decide to become vaccinated, and kind of what led up to that decision as well?
Those are some really good questions. And I would say what led me to ultimately, well, let me start here. When I first got admitted into ICU, the isolation, no family, no friends. I couldn't really talk on the phone to my husband or family and friends because I couldn't breathe. So the isolation alone really took a toll on my mental health. And I actually had to get on antidepressants while I was in the hospital for a time, just to kind of, make it through a lot of the mental challenges of isolation. And I felt irresponsible. I felt like in everything that I was doing to protect me and my baby, I didn't do a good enough job, because here I am now. And I also said, there wasn't a lot of data and information about, the effects of pregnant women getting the vaccine. But I asked myself, did I do enough research? Did I ask the right questions? Did I ask enough questions? So I put the onus kind of back on myself, like, what research did I go looking for just to understand the implications or the effects of a woman pregnant who's getting vaccinated? And what changed my mind about the vaccination, it wasn't my doctors drilling it into me, because they would come in every day like, can we wheel you downstairs on your oxygen tank to get vaccinated? I still was hesitant because I didn't know if it would send me into early labor, if my baby would come out, as you say, like having 3 arms, Lucy. But seeing nurses who had been vaccinated and got pregnant after they were vaccinated, I literally had I was in the hospital for over 2 months. So I had over 100 nurses that I encountered throughout that time. And so many of them have been vaccinated and gotten pregnant afterwards. And in seeing that, I said, wheel me down, give me the vaccine. And I literally got vaccinated while I was hospitalized.
Right. So it was the evidence of it in front of you that it really convinced you, which I think is really helpful, because I think, and that's why hearing from you, Trices and Lucy, like actually hearing from women who've had to go through, and even Dr. Edith, even hearing from you, right? You had to go through your own set of decisions as well. Let me just throw it open to the group. And on this point, there's a Facebook question, and Dr. Edith, I'll come to you, and Ebony, if you want to weigh on this as well, feel free. There's a question that's, which is a really smart question. Talk about how it is possible that antibodies cross the placenta, but the vaccine itself can't. I mean, just scientifically talk about what that process really is.
Mm-hmm. Sure. So the placenta is this amazing thing that I feel like we learn about more and more as time goes on. It does an incredible job of filtering out things that might be harmful to the baby, as well as the baby's waste. So if you think about it, carbon dioxide from the baby that needs to be filtered out, the placenta goes through the umbilical cord to the placenta and out of the body, right? And oxygen that needs to go towards the baby gets to the baby through the placenta. So the placenta has a way of getting, what the baby needs towards the baby and what the baby does not need, it might be toxic to the baby, out and away from the baby. When it comes to antibodies, that is the case as well. And we know this from a long history of vaccinations as well as infections, right? For women who are pregnant, and I'm sure all of us experience this, we are offered the diphtheria, tetanus, and pertussis vaccine during pregnancy. And we know that when we get vaccinated during pregnancy, those antibodies go towards the baby, right? And the baby's born protected. And this is well established and known for a long time. That is the case for other infections as well, not just COVID-19, that the placenta has a way of getting the things that the baby needs and the things that are beneficial from mom towards the baby. And now when it comes to the chemicals in the COVID-19 vaccine specifically, I would just like to briefly remind people that the quantities of these chemicals are so small. Like, this is not like you're, I don't know, drinking from a poisoned well or something like that every day, right? Like, you're talking about microscopic, minute, tiny amounts of chemicals that are given one time. And not only are the quantities super small, the placenta is able to filter out what the baby does not need and might be harmful, right? So it's almost like a 2-layer of protection. Not only are you giving a very small amount, also the placenta has a way of filtering it out.
And it seems like the question is, the vaccine goes into your body. How is it that maybe you could just briefly describe for everyone, how does it go from vaccine to antibodies in the body to antibodies that go to, like, what is that process of vaccine creating antibodies and then antibodies going through the placenta?
Sure. So the vaccine, what it does is it tells the body to make immunity, to make antibodies, right? So let's talk about the mRNA vaccine. mRNA is a fancy word for a message. The message is to tell your cells in your body and the immune system, please make antibodies to protect me and against an illness in the future. So your body goes ahead and makes those antibodies. Those antibodies are chemicals in your blood, right? Like no one really talks about antibodies like chemicals, but they are sort of your natural chemicals that you are making to protect yourself from an infection. And the beauty about it in pregnancy is that those chemicals that you are making are sort of perceived by the body as being good chemicals, I guess is the way that I would explain it, and sort of passed on to the baby, because the body is a very, very wise thing, and is seeking to protect you and your baby.
Right.
Also, to jump in here, I'm sorry to interrupt, Stacey,
No,
and
please.
I'm not a doctor, so please, doctors, correct me, but something that was helpful that really helped me wrap my brain around it was understanding the difference between the COVID vaccine being an mRNA vaccine versus a live vaccine, which they do not administer to pregnant women. So, the live vaccine, like for example, varicella, the chickenpox vaccine, I was given that before I got pregnant, because once you're pregnant, they tell you not to get live vaccines. And I think a lot of people think of the COVID vaccine as being, they're injecting me with coronavirus and they're putting the virus in me. And so it's obviously going to go attack my baby. Whereas it's just triggering, as you said, it's just a message to create these antibodies, which can then transfer through the placenta, but it's not like coronavirus is flowing through your blood and getting to your baby.
That's exactly right. That's a very good point. I think a lot of people do think, oh, I'm being injected with a virus and therefore, of course, I'm going to get sick from this from this vaccine. But that's absolutely true, and very good explanations for both of you. Ebony, tell me a little bit more about what you're telling women right now. I mean, I think again, and I hate to think about seeing the news of another variant that could be coming our way. It's just something to that all of us are just frankly exhausted with all of it. But the fact of the matter is that viruses are doing what viruses do. They mutate, they change, and they try everything to get to people that to try to infect people. And that will be true, especially harmfully true for a lot of unvaccinated people. So what are you telling folks right now, pregnant people, that you see that they should be doing right now with respect to protect themselves right now while we're still in the pandemic, and to protect themselves for a future spike that we may or may not experience, but we have to be thoughtful about that it could occur?
I like to tell people it's not over. I mean, I feel like a lot of people feel like it's over. Sometimes my spouse sometimes is like too free with like the mask. I'm like, no, it's not over. It's not over. So just reminding them that like it's still important for you to be vaccinated. It's still very much so protective. And just to kind of like tag on just a couple of points that that I will commonly use in relation to what's been said. I explained to people about the booster. I'm like, there are multiple vaccines that require multiple injections. COVID is not the first one that requires multiple injections and also a booster. And then the other thing too is, I will say to them is like, COVID isn't going to wait until you're not pregnant. I'm just going to be real honest with you. It's not going to wait for you to finish the pregnancy or make a baby. It's going to happen when it's going to happen. And so don't use that as an excuse on why you are deciding not to. And Catrice, your story, I was over here tearing up, girl. I was trying to keep it together, but working with a predominantly Black community, understanding the generations of distrust with historical systems and why there's so much resistance, and trying to advocate for this community as a provider working on the front line. It's really hard to get people to believe, but I'm out here still trying. I'm out here still supporting it. I'm out here recommending. I get random Facebook messages, Instagram messages from all types of people all the time, and I'm telling them to get it. And I also just wanted to highlight, I'm not a brand new mom. I'm a two-year-oldish mom, but still breastfeeding. We didn't talk about breastfeeding, the benefits of the antibodies being passed through when moms are breastfeeding. And that is partially why I have not been pressed to wean her. Because I feel like it's still productive because this pandemic is still going on.
It's a great point. It's a great point. Contrice, how do you, first of all, how is CJ doing now?
He is amazing. He's remarkable. He is the brightest star in our galaxy. He's amazing.
So are you talking to other pregnant people that you meet and that you see and telling them about your experience? Are people coming to you, sending you Facebook messages now that they've heard your story? And what are you telling pregnant people that you interact with that they should be thinking about with respect to their decisions?
You know, it's so funny you say that. There's a lot of Facebook debate that goes on about this, and I'll see my name tag like chime in, and you know, it's a no judgment zone for me because I was on both sides of the track. And I would say my story impacted not only pregnant moms, but just people who chose to not get vaccinated. My entire network went and got vaccinated because of my experience. And those were, you know, people who were very reluctant, you know, elderly who were like, we don't know what this is going to be. My friends who are young professionals who were also like, let's stay away from this. From my experience while in the hospital, they all went and got vaccinated. So I feel like my story impacts and transcends across not even just pregnant women, but just people who were vaccine hesitant from the start and people of color.
Yeah.
So
Lucy, how do you, I mean, you, like Contrice, I mean, you have made decisions about getting vaccinated, but you know, you guys have, all of you all have little babies, little toddlers, little infants, newborns. How do you deal with family members or friends because your babies are not, and your children are not able to get vaccinated? How do you deal with that in terms of being around people that you think might not be vaccinated? And do you have conversations with people about becoming vaccinated? I'd love to hear how you navigate that, really with the mindset, if I were you, and I'm sure I think the way you probably do, like, I want to keep my baby safe. I want to keep my kids safe. So I want to make sure they're in as safe as of an environment as possible. So tell me a little bit about how you've navigated that.
Yeah, it is incredibly difficult. And, you know, for me, this, and as with the other mothers in this Zoom, you know, this started in pregnancy for me. I was pregnant throughout, you know, my whole pregnancy was through the pandemic. And so I had these visions in my life of what my pregnancy would be like. And that included seeing my friends and letting my friends watch my belly grow and, you know, going to my friends' bachelorette parties and weddings with my baby in my belly and, like, you know, having family around. And pregnancy turned into an entire isolated situation of not being able to go to my best friend's wedding and staying out of events because I was trying to be, even though I was vaccinated, I was trying to be ultra careful. And then, of course, with the birth of my son, he was actually born like a couple of weeks before the Omicron wave. And we kind of were feeling like things were in an okay spot. Our pediatrician told us to just make sure that anyone that came over was wearing a mask while holding him, at least in the first couple of months. And right around the time of Omicron, we sort of had to lock down again. And it's really difficult. We both have families in the area nearby. We have siblings, so aunts and uncles of Milo, and both sets of grandparents. And it's kind of hard to just try to keep tabs on what everyone else in your family is doing when everyone else has their own job. Some of them are hybrid, going to the office, staying home, and everyone wants to see the new baby and spend time with the baby. So it's, in the beginning, it was a lot of, you know, anyone who comes over must be vaccinated. And we are lucky enough to have our whole family is vaccinated. And so I also am lucky enough, I guess, I don't have any close friends who are unvaccinated. And I think if I did, I would probably say we're not allowing unvaccinated people around the newborn. At least, you know, obviously there are other issues aside from COVID, but at least COVID was the main concern. But especially in those first 2 months before the child gets any vaccines, we just wanted to kind of keep him away from almost everyone except for close family. And anyone that came over was coming into the house, washing hands, taking coats off, and coming in. Oftentimes, if they were kind of, you know, going into an office or doing something, we made them get a rapid test before they came and make sure that they were negative, as well as wear a mask if they had gone into a, another, if they had walked into a grocery store or something, they were wearing a mask. And sometimes once we felt a little more comfortable and we knew that people had tested negative, we would let people come over and only wear a mask when holding the baby, but then they could take it off when interacting in the room, which I don't know, the amount of conversations my husband and I have had about, well, what's the point of that? Because if they're talking to us and then I'm kissing the baby, it's all just like a big guessing game, to be honest. And it is very, very stressful. But I think the most you can do is try to be around people who are vaccinated, to be extra safe, hands washing and masks wearing, and doing a rapid test. That's how we've been navigating it.
Yeah. And Trice, how about you? Have you navigated that as well in terms of keeping your baby safe within the realm of people that may be vaccinated or unvaccinated? Have you been making those judgment calls?
I legit had PTSD.
Yeah.
And so I was very extra, the excitement that everybody had about me having a baby, the excitement that I shared, it was somewhat hampered because my husband was even hesitant to let my mother hold our son in the hospital. Like, it was just all a sticker shock because my husband just kept having the thoughts of when the doctor came to him and said, if we have to save, if we have to make a choice, who do we save? Do you want us to save your wife or save the baby? So all of these things are playing in your mind when you're like, you want your family to be able to enjoy your baby, but you want your baby here more than anything. And so we only let like my mother and my husband's mother around the baby for the first few months. We didn't even let my friends come over. And when they did, they had to wash their hands, they had to wear a mask, they had to be vaccinated, and they had to take a test to prove they were currently negative. But then after our son started getting his vaccinations, we opened that up a little bit. I mean, just a small window. And we let like his godparents touch him, but everybody was so afraid to get him sick that they were even very cautious. So now, even though we're still cautious, we don't let everybody hold him. You definitely better not kiss him. We're a little bit more open because majority of the people are vaccinated. We don't necessarily require that you wear a mask because his immunity is it's really good now. I've been breastfeeding. He's had majority of his shots. And so we're much more comfortable now, but we're still very cautious. If you have a cough, you can't come over to the house just because we can't risk it.
Yeah. I think it's really interesting how the whole idea of PTSD, I think, has affected a lot of us.
Yes.
And how you can be in a room and someone coughs, even now, like I'm in my office and you hear someone cough and all of a sudden it's like, clear out. It's just, I mean, it has driven all of us kind of nutty, and it's unfortunate. Ebony, please jump in.
I was gonna say that I had my baby right at the beginning of lockdown.
Oof.
And so we did lots of like car drive-bys. I would literally take my newborn, like, and they'd be like by their house and be like, she's here. But yeah, because we couldn't, especially at that time, no vaccine, and like we were still like in the thick of it. But I will also talk about what it is to be a provider, right? And especially like in December, almost all of my admits, all of my patients had COVID. And then I gotta come home and I named her before the talk. I won't say it here, but she is somewhat of a breast bully. Coming home after working with all these COVID patients, and like the regimen of like telling my husband, don't let her see me, like shower, scrub, before she jumps on me. It's been really sad. It's been really sad and really, really stressful. And even with all of my like great efforts, sometimes I was wearing like double mask, shield, headgear, all the different things, just still being worried, when I come home to my baby.
Yeah. We have just time for one more question on that point. And Ebony, you brought us back to the issue of breastfeeding a little earlier. There's a question from Facebook asking, and then Dr. Edith, if you want to chime in on this too, but Ebony, do we know, how much do we know about how long antibodies in babies last as a result of breastfeeding? And I heard you say, what a lovely thing that you're still breastfeeding now 2 years into your child being here. That's a great thing to kind of keep them safe. So what do we know about that? And can you share more about that?
I don't know about the timing. I don't. So
Okay.
I'll defer to Dr. Edith
Dr.
if
Edith?
she knows.
Yep, go ahead.
Yeah, so I assume that you knew because you're doing the exact right thing. So,
She
the
knows,
antibodies and
knows in her mind. But
yeah, you know in your mind, is that mama wisdom.
Mama wisdom, that's right.
So the antibodies in the babies are only present as long as you keep breastfeeding. Unfortunately, because they're not antibodies that they made themselves, their body breaks them down pretty quickly. If you keep breastfeeding, you keep giving them those antibodies, so they keep having some to protect them. But when you stop, unfortunately, that sort of supply of antibodies, fresh antibodies, ends, and that extra protection ends as well. And I've had actually many patients who also have chosen to keep breastfeeding longer than they would to give their baby some protection until a vaccine is available for kids. And it's really remarkable. And I feel like you all touched on this already, but like when it comes to, keeping our baby safe from, other people bringing in germs, when it comes to childcare in the pandemic, when it comes to isolation in the pandemic, like we've just faced so many stresses. And I feel like we've aged, I don't know, 10 years. I feel like I personally have aged like 10 years since having my baby, and it was, he's only 6 months old, and it's insane. And then on top of that, something as, time intensive as breastfeeding, I'm having so many women in my practice who are choosing to keep breastfeeding, and it is really not easy. And so I just, kudos to you, Evan, and to all the moms that are choosing to do this. It is so hard doing it myself right now. It is so hard.
Well, we thank you all for being such great moms, all of you, and so smart in terms of how you're thinking about your health and your baby's health. And thank you for sharing both your knowledge and your information and your experiences. It's fantastic and it's helpful. I want to just say a couple things before we go. This is a really important time when we have this backdrop of this pandemic. We are facing in the US really serious issues. Even before the pandemic, we were facing a very significant maternal and infant health crisis in this country. The fact that the US today is considered the most dangerous developed nation in the world in which to give birth is just simply shocking. And we know that in the past year, or based on 2020 data, we saw an 18% increase in 1 year in 2020 in maternal deaths due to pregnancy and childbirth. And while we don't know for sure how much of that goes back to women that contracted COVID-19, we do understand that a lot of women did not make it through pregnancy and childbirth because of contracting COVID-19, because in 2020 we were not vaccinated. And so what we want to make sure that we can do is to do more to elevate our voices, to protect women in a pandemic, not in a pandemic, with the kinds of policies that will protect pregnant people and their babies. And there's a lot of work we have to do. So one of the things we're doing at the March of Dimes is we now have these days in state capitals around the country called March for Change. And there probably is a March for Change that is in your state or coming to your state soon. We're activating and advocating for a lot of different policy changes, like extending Medicaid postpartum from 60 days to 12 months, so that women have more coverage even after the baby comes, increasing newborn screening statutes, expanding access to midwives and doulas, which Ebony is probably, thrilled to hear as a midwife herself. Join us on April 27th for March for Change probably in your community. We have some other dates even coming up even after April. But if you want to be an advocate for these issues around maternal and infant health, we would invite you to join us. And you can certainly get more information at marchofdimes.org/March for Change. Share it on your social media, come out and join us and be a part of letting policymakers know how important it is to protect moms and babies. The second thing I want to remind you of is March for Babies, which is our annual event, our campaign to get a community of people to come out. Moms that have been impacted by premature birth, and families by stillbirth, by loss of a child, by maternal health challenges, women and families who've had healthy babies. You know, what we want to do is to make sure that every single baby that is born and every single mom is as healthy as possible. March for Babies is our huge campaign to get people engaged in this issue. If this is a cause you care about, come join us at A Mother of a Movement and be a part of helping to really support the March of Dimes and our work and the work we do with so many partners. There are March for Babies events in your community. Even if there isn't one in your community, you can still walk on behalf of March of Dimes by downloading the March of Dimes Charity Cloud app at your app store. You can walk in your own time, at your own pace, in your own way. You can raise funds. You can have people give you money for the miles that you walk. We have been doing this fundraiser for 52 years. When I was 12 years old in Atlanta, Georgia, I walked 20 miles for the March of Dimes. And here I am, president and CEO of this organization. So it's a lot of fun. And it's a way to come together as a community to join up with others who care. So I invite you for more information, go to marchforbabies.org on that. And then last but not least, I just want to say again, thank you to the Kaiser Family Foundation for joining us and for being a part of collaborating with us on this webinar. I also want to thank Cigna for the support of today's webinar. And then lastly, if there are resources that you still need access to, here's a slide of a bunch of links. They may also be in the comments as well. But if you want more information about some of the information that was shared today, here are a bunch of trusted resources. If you don't remember anywhere else to go, you can go to marchofdimes.org/COVID-19. You can go to Kaiser Family Foundation website, greaterthancovid.org, CDC, and others as well. But I just want to say to all the panelists, thank you all so much. You guys have been fantastic. Appreciate you being here today. And thanks for joining us. And we'll be back next month with another great series. So thanks everybody for joining today, and see you soon, and stay safe and get vaccinated. Bye.